Hello, everyone. It's Ashley with Amare, owner and founder of Amare Healing Arts, Plastic Surgery Recovery Center, and Holistic Clinic, specializing in manual lymphatic drainage. We have 2 locations in New Jersey, Highland Park and Elizabeth, and I also offer virtual consults. If you're not in New Jersey but still need help with your recovery, you can give the office a call at 732-841-0142 to set up your sessions. We have our post-op shop where we offer post-op supplies like lipofoams and BBL pillows, and I teach you guys how to use those products with the videos that we have on our product page. That's amarepostopshop.com. We also have our online courses where I teach you guys what massages you would need after plastic surgery, when to get your massages, who to get them from, what the lymphatic system is, what lymphatic massages actually are, and all the research that you would need on your post-op massages and finding a lymphatic therapist. All of these links are in our bio as well as in the description boxes, so you guys can go and check that out. I will see you guys soon. Ashley with Amare. Bye. We're going to do a live today with my lovely Kathleen Lisson. Plastic Surgery Recovery Handbook. Oh, hi, there you are. I was just telling the people what we're going to be doing. We're going to be doing a live on common compression garment questions and mistakes. We're just out here winging it. So I guess for this live, if you guys have questions about like compression garments post-op, drop them in the thing. I'm not Instagram literate, so Kathleen's better at this with the finding people's things, so you let me know when people ask questions. But yeah, hey, first of all, hi. I miss your face.
I miss
Hello.
your face too.
Okay, so how was your day?
It's amazing because you know where I'm going to be next week.
Yes, I know where you're going to be next week,
In
and I will not be.
for the
I know,
Yep.
and unfortunately, I will not be there. I'm very sad about it.
Yeah, but I'm learning as a lymphedema therapist. It's really important to always learn about the updates in compression, the new technology, the new features. So it's been online for the last 3 years, but I'm really happy this will be my first like in-person Juzo event. And then I'm going to Power Lymphatics at the end of next month. That will be in Denver for lymphedema therapists. And a great opportunity. And the Power Symposium is all about compression. And then Power Lymphatics is compression and also stuff for lymphedema therapists. So these are 2 springtime opportunities. And then if you're in a larger city, you can always look and see if Essity, Juzo, Sigvaris, Medi are doing community events, and this one, one of my lymphedema therapists that's in LA got the invite, so I saw that she was going, so I signed up too, and it's really great to learn, especially from the German compression manufacturers, because they actually have regulations in Germany, regulations followed throughout Europe, to actually have proof as to what is going on in the factory is what they're putting on the label. So that I really love that they are at the cutting edge of getting you the latest technology as far as compression. And we see a lot more of different types of textures, compression, and then the difference between like circular knit and flat knit is different as well, and those different textures of those different compressions can help if someone has fibrosis. We will put them in like a flat knit garment, and then I'll use different types of textured compression and different types of textured foams to help people. So this is all about, compression is all about helping you to reduce swelling and to reduce fibrosis.
Exactly what she said. So yeah, let's talk about the basics. So compression garments, right? A lot of people think they make your swelling go down. Compression garments are meant to close the gap so swelling gets out of that gap. So what gap are we talking about? Let's take liposuction, right? Because it's easy. There is skin, there is tissue, there is muscle. The tissue and fat in between here is being sucked out. So now that is like a void in your body. It's like an empty space. Your body's not just going to allow you to have an empty space in it. Its job is to heal. So it's going to fill it with swelling to start healing the area. Swelling is healing juices. So what compression does is it makes sure that as your swelling starts to go down or as you start healing, that gap stays as small as it can be so that you don't heal with all this swelling inside of you in that little void. It's called the interstitial space. So the compression, your compression garments post-op, compression garments in general for lymphedema, for all kinds of swelling, are meant to close the gap between your skin and your tissue and your muscles so that it doesn't fill and heal with swelling in it. So when we're talking about compression garments post-op, and like Kathleen was talking about flat knit versus circular knit, it's how they close the gap. So the most common thing is over compressing, right? So people think swelling gets out by compression, so they squeeze the living daylights out of them. You're not allowing the tissue to heal in that space because you're squeezing it so much, it's being cut off of blood supply, oxygen, nutrients. And mind you, that swelling is healing juices. You have proteins in there and all of the little building blocks for tissue, if you want to call them, that sit in that area and start laying all the things down to make the tissue nice and flat. So when we have compression that's too tight, you're cutting into that space and it's not allowing it to heal properly because it's cutting off all the flow of nutrients or the flow of your lymphatic fluid, which is swelling. So over compressing is one of the biggest problems that I see is everyone trying to squeeze themselves to get snatch. You don't need to get snatched. You already are. You just have swelling on top of your snatchedness or your results. That's what the compression garments are there for, is to get that swelling down and keep it down. So it's not meant to get swelling out. It's meant to close the gap so swelling doesn't sit on top of your results and heal in there. Us as lymphatic therapists, we are getting your body to reabsorb the swelling, not the garment. That's not how that works. The garment is there to close the gap, not to do the actual work of getting your body to reabsorb the swelling, which is why, like Kathleen was saying, there is a difference between when you're talking about like lymphedema and fibrosis and chronic swelling issues. There's a difference between the type of garment, the way the garment is made, there's a difference with that. It's not just like all these fajas out there are all just fajas. They're all really rigid and things like that. And I think that's a lot of times, Kathleen, where people get confused because for us in the lymphedema world, it's easy as far as like circular knit, flat knit, what they do. But in the post-op world, they're stage 1, stage 2, stage 7, 8, 12, 15, but no one's explaining what we're talking about today, which is the difference in how the garment's made, the material, things like that, that affect how that gap stays and gets closed. The point of stages is to keep that space closed at the same pressure your entire recovery. It's not to continue increasing pressure your entire recovery. It's to maintain what they call MMHG. So it's the way that they measure pressure. It's mercury grade compression. So it's the mercury grade part just means the amount of pressure. So your garment, your entire 6 to 8 weeks of lipo recovery is supposed to stay at that 20 to 30 units MMHG of pressure. But the problem is when you're shrinking from your swelling going down, your garment gets loose. So then that pressure isn't maintained. And maybe now it's only 10, let's say, units, right? MMHG 10 pressure. So that gap isn't being closed. It's open a little bit. And you start to have all that swelling building up in there. So that's why it's important to make sure on the flip side of that, that your garment is properly closing that space at the same pressure your entire recovery, not increasing pressure, because then that's going to trap all that swelling and turn it hard and stagnant, lymphostatic fibrosis. So lymph, swelling, static, fibrosis, which is where all those proteins start to build up in your tissue and in that space, and that's how we get that hardness. So over-compressing or under-compressing can cause that whole situation. So it's kind of like Cinderella. We got to find the right fit and keep it that way your whole recovery. I know you're laughing at me because Disney references, because I'm obsessed with Disney, but that's exactly what it is. We want to keep your compression the same ratio. And in Germany, when you're testing, this is why Germany has such great regulations, because the Amare garments are tested for this. There's something called a Zwick machine. which is basically a little ball in a tube, and they put the fabric in between there, and they drop the ball, or they use air pressure to test how much pressure bounces back on that ball from the actual fabric to tell what that 20 to 30 mmHg is. So our garments were tested with the Zwick machine that's regulated by Germany to make sure we're getting that 20 to 30 mmHg. And when you're shrinking and you run out of hooks because you're on the tightest one, then it's time for a smaller garment, like with lipo. So that's how we get into the whole like 3, 5, 10 stages of garments. It's not really stages. We want to keep that same pressure. It's just you're going to need less fabric to keep that same pressure because you're shrinking. So that kind of answers the biggest question of garment super tight or garment loose situation. But yeah, our garments are Zwick tested from Germany, which I love because we have all the science on the Amare garments, which is nice so that they actually explain that whole thing. But yeah. What do we got? Questions? You do the question thing because
Yep. A question that Clarity of Soft Tissue just asked, what are some verified garments you guys used? So there's definitely some that come over from Germany, and it's nice that the Amare do too. The next question is, so as the swelling down, do you stay with the same faja, just a smaller size?
So that's the thing. When you're talking about garments, it's like buying a car. There's Mercedes, there's Lexus, and then there's like C-Class, ML, E-Class, like a million different kinds, right? So we generally like to stay with what your surgeon gave you. If it's working, that model type of that brand, yes, we like to stay with that, but go down in size. But sometimes what you get initially is not the best model for your surgery. Like I see a lot of people that won't have a BBL or a breast aug done, but they come in with a garment, it's just lipo. They come in with a garment that's got arm sleeves and the BBL part and the breast thing, and all they had was lipo. And now when you're talking about garments, depending on where the seams are, depending on how the fabric is and where there's fabric, that arm piece is going to change the compression of this. It may be better or it may not be. It may be worse. Because if you had all of this under here done with your lipo, yes, you may want all of this covered and compressed properly. But if you didn't have any of that done, and every time you move, that garment's digging into you or pulling rather than holding smooth, we may want to get you a different model of that brand, or we may want to stay with what you have and just add the Amare lipofoams to moderate that 20 to 30 compression to make sure that no matter what garment you're getting, the 20 to 30 mmHg stays moderated in your garment. So it's always good to stay with what your doctor gave you because that's what they use for your surgery. It's specific to your surgery, but it depends. That's like it depends kind of thing. But generally, it's always good to stay with what you have. Get a smaller size as long as it's not cutting into you or doing any of the craziness.
And I would say this is one of the questions that you need to talk to your surgeon about, not after you've had surgery, before when your initial consult and you have been battling surgeons and you see 3 that you really like. I want to know if that doctor really knows what they're talking about when they talk about compression, when they talk about lymphatic massage, when they talk about like what you should eat afterwards. Like ask all these questions. And if you hear any like answers out of left field, then that is going in your little notebook. And it's like, oh, well, he says I can just not wear compression at all, or like wear something from, you know, that I pick up at Target, or like just buy something on Amazon. Like that's giving me, it's giving me red flags, at least a pink flag. No, it's giving me a red flag.
I'd say orange. I would say it's more orange flags.
If you're getting like 3 and 4 liters of liposuction and the surgeon just can't be bothered to have a protocol for post-op, like I'm scared and I would not, me personally would not go through with that surgeons. So let's see. And then, so okay, so we did that. Clarity of Soft Tissue is asking what compression bands are trusted. And again, we talked about the Amare. And then that's, if they go to your website, you have a link in your bio.
Yeah.
your post?
So right now, the garments aren't launched online yet. In order to get an Amare garment, you have to be fitted by me, either doing a virtual or in person. And this is the thing, we are launching them at the end of the year, and we're going to put up there like the Zwick data and everything for it, showing that it's 20 to 30 mmHg. That's not going to be probably until September though, where they're like open to the public, anyone can buy them. Right now, if you're looking to get a trusted garment from me, I have to see you, like either virtually or in person, because one, I have to measure you properly and make sure that everything is the way it is. Two, fibrosis compression is different than swelling compression. So with fibrosis, we want to make sure we're putting in the Amare lipofoams so those proteins start to get dislodged and free floating again and turn back to swelling, because fibrosis is a buildup of proteins. So as that starts to get moving again, we're going to need to make sure the compression in that garment isn't just like compression for swelling. It's a different way of doing it. So your size is going to be different because we have to put in the foams, but then we also have to have enough room in the garment. And it's a very fine line, enough room in the garment for the foams to work properly without being like squeezing the living daylights out of you in there. So this is the other reason that we're waiting to release them online, because I'm going to be releasing a series of videos for them and putting up all the data, and it's going to be a big thing. So that's not just like willy-nilly you can buy a garment from me. You have to talk to me. Now, I do have therapists that I train that are in other states that I train, and I teach them all of this, and they buy a bunch of the garments in a bunch of different sizes to give to their clients and fit their clients for. And I teach them how to use the foams as well. So then they'll get the foams from me and the garments, they purchase them wholesale, and they can use them for their clients and explain to them everything I just explained. So the compression ratio and how all of it works with the lymphatics and the swelling. That is also something that we do now. But as far as for just like a client being able to purchase it that I've never seen before, you have to see me first, because all of that has to be explained.
You know what? And that's the state of patient care. That's actually what should happen. This is will really go off the rails and have a problem. And like I was talking to someone else earlier this week, that people can open up their drawer and have like a box, a drawer full of socks that don't fit for their lymphedema because they weren't properly measured, and just invest in the correct garment. You can get like 7 garments that don't fit you, and it's not going to work as well as getting what garment that does. So everyone needs, we also need to know that something can be like 20 to 30 millimeters of mercury, but it's only that if it's in your size. You cannot say, you cannot pick your goal size. Like, I want to be a 22-inch waist. You can't wear a garment that's like an extra large. If you're a medium, you have to wear the garment that matches the body you have today. And that's what, and a lot of people are scared to make such a purchase, especially that it's going to help you after surgery, without having input where they can have, she's on the screen, you're measuring, you're asking questions, she's answering them. You can be confident that you're getting the right garment. So Clarity of Soft Tissue asks, how many garment changes do you usually see with clients? I usually see 4 fajas. I see clients mostly after skinny BBLs where it's like 2 or 3 liters of liposuction. So I think it may be more garments if it's more liposuction. But usually they'll walk in with the garment that their surgeon comes in. And then about 7 to 10 days, they'll be smaller enough to go down a size. And then about like 3 weeks, it'll be a smaller size. And then it's either they can get that garment altered, or they like their results at like 5-6 weeks, because that's when the doctor kind of wants you to taper off the garment wear. And again, this is 2 liters of liposuction with the Brazilian butt lift, 2.5. And then it's either you get that garment altered, or you love your look, you're only wearing it like 8 hours a day. And then I'm like, great, let's just wean you off. And then what I want you to not have is like 15 different garments, because you do not have a diagnosis of lymphedema. You do not need to be in compression for the rest of your life. Going and getting liposuction should not be a sentence of having to wear compression every day for the rest of your life, because I deal with people with chronic illness all the time, and it is not something that you want to have to do anything that makes you have to wear compression every day for the rest of your life. So how do you see?
I agree with that. Now, here's the thing. You see like this many populations of surgery. I see like this many populations of surgery. I see everybody. So when you're talking about lipo, you're going to keep closing that space, right? Because your swelling is going to come out and that space is closed. Swelling is going to come out, space is closed. I've seen 5 liters of lipo where we've gone through 6 garments. I've seen, like you said, 1 liter or 2, and this is just lipo, 1 liter or 2 where we've gone through 2 or 3 garments, right?
Yep.
Because it's just going down. Now, when we're talking about a BBL, because this is one of the most popular surgeries, like lipo 360, BBL, when we're talking about that, you are not flipping garment sizes like that. That's not, your butt is not changing size. Your butt is staying the same size. Your waist may be shrinking. Your butt, we do not want to crush at all. Well, exactly, right? That's the problem, is everybody's like squeezing themselves into these garments, and you're killing the fat before it has those blood capillary connections. And by the way, side note, feeding the fat does not mean eating fat. It means the blood capillaries making their way to the fat to supply the fat cell with blood by eating avocados and omegas and greens and things like that. You are feeding the fat. You don't need to be eating fat to feed the fat. That's after surgery, not in recovery. That's way after, when you're trying to make sure your body is not burning actual fat. That's after. When we're talking about recovery, feeding the fat is eating nutritious food so the blood supply feeds the fat within those first 6 to 8 weeks, not eating junk food with tons of salt. Salt will make you blow up and have fibrosis, by the way. Tons of salt and you're swelling like crazy. Then you're going to mistake your BBL, what's actual fat, for swelling, because your butt is so swollen from the salt, the caffeine, the junk food, not actual fat. And that's why people's BBLs take forever to heal. And back to my original point, this is why you're in a garment for so long, because your BBL is still sensitive and sore and you think it's not healed yet. It's swollen. So when we're talking about a garment, we do not want to be squishing. If you've had lipo and a BBL, you're probably only getting 2 garments, one right after surgery and the next one after that, because that BBL needs to stay the same size and heal. We're not crushing it. So what do we do about the waist then? Because your waist is going to shrink like 3 or 4 garment sizes. You have lipo. That's where the foams come in. That's where the Amare lipo foams, putting that in to give you that soft compression to maintain that 20 to 30 mmHg compression around your waist, while your BBL stays 10, at most 15 mmHg compression. That's how the Amare garments are designed. So the BBL part, there's power net on the inside and there's Lycra on the outside, that material on the outside. That part is graded 10 to 15 mmHg. You're not getting into anything smaller because that's going to change everything back there. So we stay in that. But the waist part, we put the foams in. Once you shrink and that garment gets too big around your waist, we put the foams in to keep that compression at 20 to 30 mmHg without crushing your BBL. So with us, you're only getting like 2 garments for a lipo BBL 6 to 8 weeks healing. Because again, we're not crushing that. With something like a tummy tuck or lipo, any surgery that is reducing without any addition, you're going to keep going down in size. And it can be anywhere from 2 garments to 4 or 5 garments, depending on how much you've gotten taken out and how much work you've had and how much you've reduced. With something where we're putting in fat transfer, either to the breasts, which I just did a video on, or to the booty, or to wherever. Some people get fat transfer to their face. I've seen fat transfer done to the sides here to fill out like a divot that they've had by the breast to give them a little more shaping. So it's not like fully fat transfer to the boobs, but just to fill those areas. I've seen it everywhere. If we're doing addition surgery rather than subtraction surgery, you're not going to have as many garments because because we can't be crushing that. But that's why it's so important to work with someone like me that specializes in compression post-op, because you're going to think, oh, well, my waist is going down, so I need to be in something smaller. And then your booty doesn't fit and you're crying and frustrated because you don't know what you're supposed to do. And then you wind up using boards and binders and over compressing your lipo and wind up with fibrosis. So you have to be careful as far as the compression you're choosing for your surgery, like Kathleen was saying, making sure that the compression you're choosing is for your surgery. You're not going to wear high heels to go running. You got to make sure you have the right thing for what you're going through.
Yeah, great. Okay, so we have a bunch of questions. The first one is, how does an MLD therapist become certified in compression fitting? So I got certified as part of my CLT class. And then once you're a CLT, you can have access to these other compression fitting certifications. So if you really want to do a deep dive, I would suggest, and you're already an MLD therapist, you already have the hands-on, I would look into getting your CLT. It's a really great next step in your education. And it's as part, you'll learn so much about like the theory of compression as you work with short stretch bandages and foams, and they show you how to cut foams to form to different parts of the body, and Coban too. Like all these things that we could talk about that would take us hours to get through. It's because it's all in that CLT class. So definitely check it out. When do you know that you're completely healed, and how long does it usually take to heal? Also, do I have to work out? Yes, you have to work out. Do not fuck up your results by not working out. This is a complete lifestyle change, or else you are just going to, like, either you invest in the gym and you invest in working out, or put it in a bank account because you're going to need to see a plastic surgeon again.
Yep.
Does alteration affect millimeters of mercury or pressure of the garment? Definitely. Yes.
Yes. We are never a proponent for altering garments. Why? Because you're sending it to, so Happy Alex said, fuck around and find out, Kathleen. We do not, you're taking it to a seamstress who does dress alterations and know nothing about compression. So God forbid those seams are too tight, or if the way, so there is flat knit, right, and circular knit. So this is the way the seams are. We're either having seams, flat knit seams on the garments where the seams are flat, or circular compression where there are no seams on your garment at all. It's the way that it's designed to knit together.
Like
so when you're talking, yeah, like a sock, exactly.
Put on every day. It doesn't have a hem.
Right.
Yeah.
Right. There's no lines in it. So depending on what kind of garment you have, I think there are some merino garments that are circular knit. So if you take that to a seamstress, they're just going to make seams everywhere, which is going to pull on the fabric of the garment. So let's say, because this is easier to demo, let's say we have a shirt, right? And all of this is too big, and we just pull like this. Look at what happens to the middle of my shirt. All of this is getting super compressed, and now this is getting pinched and pulled on the sides like this. Look at all of this and all of this. This isn't even compression. So when you have a shirt that just fits tighter naturally because the seams are pulled in a certain way, all the fabric lays flat the way it should. But when you take it to a seamstress and they just take out a chunk of fabric here, just like this, you're going to have tighter spots. You're going to have spots that don't have even compression. You're going to have spots that bunch in the garment. I never suggest altering garments. I suggest, and this is why we designed the Amare lipofoams for the areas that are looser in the garment, because that's going to keep and moderate the compression in the garment overall. That's why we don't suggest seamstresses, because I've seen way too many people come in with garments where one seam is super long, the other one's super short, or they're pulled too tight. Because again, it's for compression. It's not just a regular under a dress situation. Kathleen, do you suggest it? Because I don't. They're taking them to seamstresses and alteration people that know nothing post-op.
Yeah, and that's the thing. Like, where are you going to find someone? And you can. So I know there was in the before times, before the pandemic, you could go. There was a faja shop. There was a faja manufacturer that would seam their garments for you. If you had that garment and you went back to their store, they would do that. So that's something that they could do, because like they have the garment and they're there. If there's a problem, like you could take it back to them. But yeah, I mean, is it like your grandma? Is it the lady at the dry cleaners and she knows how to also seam the end of your pants? Like that has to be like do a gut check and see, like, are you close enough to your result that like you can risk that or not? So, I mean, if the question is like, should you find someone that doesn't really know, that doesn't specialize in that to do an alteration, or should you just use more foam on your garment? Like, why not let's use more foam on our garment? Because I can always take a foam out or put a foam in. But what am I going to do if that seam is not giving you even compression? The next question is,
it takes really long too, by the way, to get that garment back. It's not like in one day. Sometimes it's a week, sometimes it's 7 days. It depends. The foams might be a better option, but yes, continue.
And I mean, for most people, it's not an option at all, because the seamstress at the dry cleaner has never seen a faja before. So they're not going to, they're not going to make you any promises. Surgeons near me don't provide or recommend garments. How do I best direct my clients to get the proper garment? So the clients could talk to you?
Yeah, so they could set up a virtual with me, and we can fit them for the garments and send them out to them after we measure them, and have them, like, I'll mail them out. I usually mail them out personally after I see somebody for a virtual. The virtuals are 1:35 for 45 minutes, and we're doing the garment fitting, but we're also talking about how to use the garments you've had in the past, if you need foams, what's going on with your recovery as far as fibrosis, how that got created, what you've been doing with your garments if you're in the right garment, and then the educating part of it, so you guys understand why you're in this thing, when you need a new one, what's going on. So things like that, because again, it's not just like lipo, you need this kind of garment. Everybody's lipo is different. So the virtual consults are good for that. Yes, thank you, Alex. My virtuals are held on Fridays only. Yeah, but if you're in New Jersey, or if they're in New Jersey, the clients, they can come into the office.
Great. Do you, and Lisa asked, you wear the compression garments 24 hours post-surgery for 6 to 8 weeks?
Yeah. Kathleen, you want to take that one?
It's not going to be 24 hours because you need to take a shower, but yeah, and it has to be, first of all, it has to be what your doctor tells you, because I will always say that there are doctors in different countries that do surgeries that are very intense, and you cannot have, even if it's two ladies like us on the internet, you need to follow what your doctor says for compression, not even the two smartest and most beautiful ladies I've ever seen that love Disneyland in the world. I
agree. We don't ever suggest anything as far as like schedule until I hear what your doctor has to say. Yeah. And this goes for when to stop your garment as well, because that's a huge thing, right? So when can I get out of this? I don't care if I say you're healed. I don't care if the sky is blue. You're staying in that thing until your doctor says you're not. You could have zero swelling and be completely healed at 8 weeks. If your doctor says you're wearing that garment up until your 3-month mark for 24/7, that's what we're doing. It doesn't matter what I say. I am not your surgeon. But if your surgeon's like, oh, if you feel comfortable, you can take it off whenever you need to, or you could scale down to 12 hours. At that point, if I feel, we still have some fibrosis and some swelling, if we scale down to 12 hours, it might take longer for that to resolve. Ask your surgeon if you can keep wearing it a little bit longer. Because if they say, oh, well, if it feels comfortable, you can take it off, or kind of wear it as needed, well, then that's up to us to decide if we need it or not, and up to you to decide if we still need it or not. But if they're saying 3 months, 24/7, or if they say the first week you're not showering, you're not getting out of that garment, then you're not. It doesn't matter. And that means you may have to postpone your massages until the first time you shower or come out of your garment. And that's something I always say. If you are not sure when to come in, and your surgeon is kind of like, oh, I don't believe in massage, or do whatever you want, doesn't matter, it doesn't really give you instructions, I usually say after your first shower or the first time you get out of your garment, then you can come in. Because then we'll have been able to get that garment off of you. You'll be able to see what's going on. Because there are a lot of people that we see that have massive garment burn after the first 3 days of surgery, schedule with me, have no idea, take the garment off, and then still try to come in. And I'm like, hi, I can't touch you. Your skin is leaking everywhere. You need to go see your surgeon now. Like, no, go figure that out first. When you're okay, then we can proceed. The swelling's not going anywhere, and your body needs that swelling right now to try and heal the massive welts you have on your body from the garment reaction. So I always say, keep the garment on. Whenever your doctor tells you the first time you can shower or take it off, then we can come in and do the MLD, because you'll already have experience with getting your garment off. You'll already know that your skin under there is okay. But if your surgeon says you stay in that thing for 72 hours, you do not shower, you do not get out of it, then that's what you're doing. I don't care how much swelling you have. We will deal with it after you're allowed to. But that goes for any surgeon orders. We always follow those first.
And this, again, goes back to something I'd love to harp on. This is why you ask these questions during the initial consultation.
Mm-hmm.
Because if I had a surgeon who's like, I don't like, do whatever you want, you know, that's a little orange flag. And then if I had a surgeon that said, like, you need to wear your garment 24/7 for the first 3 months, no exceptions. Figure out if you can wear a garment 24/7 for 3 months before you book with that surgeon. And don't be like trying to change it at the 6-week mark, because a lot of people are trying to change at the 6-week mark because they are tired. They are tired of the whole entire thing.
But
so
then again, if you're working with someone like Kathleen and I, at the 6 to 8 week mark, if you are healed and there is no more swelling or fibrosis and your skin is starting to retract and you're healed, you may go in for your 6-week follow-up and your surgeon may say, oh, you look amazing. You can start scaling back to 12 hours at your 6-week mark instead of 3 months. So it can always, it's something you have to constantly talk to them about, because once they see you, because they don't really know what we do, right? They don't really know what you're doing for your aftercare. Your aftercare is your responsibility post-surgery. So if you choose to go with someone like Kathleen or I, who's like super powered in post-op, we're going to get the results a lot quicker than your surgeon may have expected. So it's kind of something we need to take step by step. There is no standard, always lipo, always 3 months, always 24/7. It really depends on how much work you're doing as far as recovery, and then communicating with your surgeon about that.
So, and then have this conversation with your surgeon. Like, hey, if I get, you know, like I'm an athlete or I'm going to have a lot of massages, and if at 6 months I look really good, is there some wiggle room there? And then listen to the surgeon's answer. And then especially if you're like, oh, I'm going to see like a certified lymphedema therapist for post-op therapy, and your surgeon's like, fuck what that lymphedema therapist said, like that is a red flag to me. You know what I mean? Because we're fellow professionals, and I want to be dealing with a physician who wants to be the head of my medical care team, but not like some cowboy who's going to go out there on his own and, you know, like doesn't believe in, you know, then like, is he going to believe his nurse either? Like, is he going to believe your general practitioner? Like, is he going to believe you when you say you have a problem? So every surgeon that I've talked to, like they're always willing to have they're eager to have a conversation with their client, because that is how you get to the best results from your client. It's much more often, like someone said, if you scroll back in the comments, that people just, they don't ask questions and they don't know what questions to ask. And then, you know, like the fact that, you know, expectations aren't met happens like at the 8-week or the 12-week mark, when if you had a quality conversation, you could have the, you know, shared expectations before the surgery itself happened. And this is another thing, like I'm going to make a separate TikTok on this, but in that initial consultation, you need to ask your surgeon, like, who is taking the drains out? How are my drains going to get out? If I get a seroma, what should I do? Should I have lymphatic massage? Do you have any recommendations? And especially if your surgeon is telling you that they need you to have someone push fluid out of incisions, that is not somebody you find on Google. They need to have a name for you, and that person has to be recommended by them, and that person has to be properly able to legally give you this type of healthcare if that's what the surgeon wants. None of this is, oh, hey, Google it. Because, and then you'll see really quick what the answer is. Especially one of my little pet peeves is the seromas. Like, how many times are you going to drain a seroma before you tell me that seromas drain on their own and just compress or whatever, and it'll go away in time. Don't worry about it. And especially if that number is 0, like, oh, and especially if the surgeon's like, oh no, I don't get seroma. Like, that is equivalent to the oncological surgeon who says that they never see clients of theirs with lymphedema.
Yeah, and I think the other big part of it is, guys, when we're talking about draining a seroma, when we're talking about pulling out drains or anything like that, when Kathleen says someone who's licensed like to do that, they're talking about an RN, a nurse, or a DR, doctor. They're talking about a licensed medical professional, not a massage therapist. In the state of New Jersey and California, where we both are, it is not legal for massage therapists to be doing anything other than massage. So draining incisions, pulling out stitches, seromas, like pulling drain, like all these things, no one should be doing that as a massage therapist in our states and New York. Those are just the 3 states that I know of because of government relations and the initiatives we're running. But there's a bajillion states that that's illegal in for massage therapists to be doing. Now, when Kathleen talks about finding a surgeon that's not a cowboy, I know we're not in Texas, but we're in Jersey, and it's all cowboys out here. There's maybe 3 non-cowboys out here. Don't expect your surgeon to have an aftercare team ready for you. Ask these questions and know that if they don't have that team ready for you, you are responsible for finding someone that is licensed legally to do these things, a professional that cares and is educated like Kathleen and I, somebody who's had experience with all of this stuff. So I am actually, to that note, I am releasing a course in the next 2 weeks. It is called, I just wrote the title today, Lymphatic Drainage Massage Post-Op and How to Find a Therapist. It's all in one course. So the first half of the course, it's 6 modules. The first half of the course is teaching you guys what lymphatic drainage massage is, because it is not draining fluid out of your body. That is not how your body works. So the first thing we cover is the medical science of what the heck is swelling? How does swelling work? Why is it created? Just like I started this video explaining to you guys, swelling is in that space to heal the tissue. We talk about that. The first module in the course is what is swelling post-op? Where did it come from? How does the body normally get rid of swelling, like when you stub your toe? Then we go into post-op. This is what's happening to your swelling that makes it last so long, that causes all these complications. This is what's going on in your aftercare and recovery that's causing all these swelling issues. How do we get rid of it? Manual lymphatic drainage. What is that? Lymphatic massage, manual lymphatic drainage. All the names that we have for it, it's MLD. It's the same thing. It's manual lymphatic drainage. Whatever you want to call it, it's manual lymphatic drainage. We are manually kicking on your body's lymphatic drainage system. So then, oh, hello. And then that's the 4th module. And then the 5th module is, how do you find someone like Kathleen and I? Because we can tell you guys all of this stuff. We can sit here and answer all your questions. But at the end of the day, your surgery and finding someone to be on your team, your surgeon may not have someone like Kathleen. And I'm out here in Jersey in the wild, wild west, getting everybody's clients from all over the place because surgeons aren't referring, they don't know, they have no idea about any of this stuff as far as the education. So don't always expect your surgeon to be able to have, and that's why Kathleen said you need to ask, because they're not just going to hand you, okay, here's what you need to do for all your aftercare. You need to find somebody, which is why I'm releasing this course. So it's going to teach you exactly what Kathleen and I are talking about, compression, swelling, the basics, and then what is a CLT? What is an MLDC? Like who are these credentialed people? Like Kathleen was talking about that course to become a certified compression garment fitter. What credentials do you need to put into Google in your area to find the properly certified credentialed person that's not going to try and drain you, that's not going to try and squeeze massage you, that's not going to just rub you with oil and call it lymphatic drainage? Someone that knows what Kathleen and I know, because there are people in your state that have our credentials, that have the knowledge. It's just the language as far as how to find them when you're typing in the Google search is not what you think it is. So that course is going to go live next week. But as Kathleen was saying, you need to make sure you're asking your surgeon, hey, do you have anyone you recommend? Because a lot of times they will not give you any names unless you ask. They won't tell you anything unless you ask. And then they'll be like, oh, I don't really know, but you can find it. Like you can go and look for it. Well, what are you supposed to be looking for? Because then you wind up in the wrong places. That we're launching that, but it's so that you guys don't have to sit here and hope and pray that you're on somebody's live and find the answers, because there are people out here that like us that have all this knowledge, because it's not just used for post-op. And that's what Kathleen was saying earlier. This stuff is used for people who have the same chronic swelling that you have after surgery, that same kind of swelling, their entire lives. And Kathleen and I are trained to work with that population of people their entire lives to constantly keep getting their swelling out and dealing with their garments and dealing with fibrosis. So when you guys think, you know, all these crazy post-op things are something like that just emerged out of plastic surgery, it existed way before plastic surgery. We're just applying it to plastic surgery because it works the same way. Your body works the same way with the garments as it would if you had lymphedema. Not exactly, but pretty much. It's a lot easier with plastic surgery. But finding that person, ask your surgeon. If they don't have anybody, go take my course and start looking for people in your area that are certified manual lymphatic drainage therapists, because that's what you need.
Yep, and this has to start before your day of surgery. Do not do this while you're like, you know, itching yourself in your faja after surgery. So we had a big question that I love that I am going to get right on my soapbox because I've heard it in so many different iterations. It's kind of like, can insert profession here drain fluid out of incisions? What do you ladies think? So it is not what I think, and it's not what Ashley thinks, and it's not what your teacher thinks. It's what your state licensing board thinks. This question is easily answered, and people need to go where you got that CNA license, where you got that massage therapy license or certification, and you ask those people, can I push fluid out of incisions? Was I educated in my school to push fluid out of incisions? And if so, under what circumstances can I push fluid out of incisions? Where can I do it? What kind of, you know, environment does it have to be? And this is not your teacher telling you, oh, no, I got you, don't worry. And even some I've heard like 3 years ago, you can work under my license. Like none of that. You need to go, yeah, right? And you need to go to the massage board, that's wherever you got the CNA license, wherever you got that, and you ask. And you don't just call up. I want you to email them so you have written with someone's name on it that they're telling you that you can do that. And the people who know that they can do it, know that they can do it because they've called their board and they know it. Just like I know that I can massage people because like I have a certificate from, it says, you know, California, and I have a certification from California. I have a permit from the city of San Diego that says I can do what I do. So don't believe your teacher. Don't believe anyone that's not from your government, because this is your license that it's at risk. This is your business that is at risk. And there was someone that says, you know, great education that people don't know. We have an NP at Nude and Nurture to legally, medically do the care, but this care in the state of California is not coming from your massage therapist. And that actually goes back to what I was saying before. When you ask your surgeon, who's going to take my drain out, who's going to get a needle and drain my seroma, that better be like someone in his office. They better have an answer for you if you're out of town surgery. And the answer is never find someone on Google or yeah, your massage therapist will do that. Because I went to massage therapy school. I never learned how to take drains out, and I never learned how to drain a seroma. And just because I can take a class and someone can show me how to do it, even if like I had drains in my head for my own surgery, doesn't mean that I can do it on you. And we're not talking, it's not whether I could and whether I could do a good job. It's legally, if something goes wrong, can you get money from me to help if I injure you in a malpractice suit? And just like I'm a massage therapist, I cannot cut you open and do liposuction. And if I try to do that, you're not getting my massage insurance to cover it, because it's not massage. In the same way as if I drain your seroma, which I won't, and you get an infection, you can't come and get my massage insurance to do it, to cover you in case anything wrong happens. And plus, but I sure as heck will lose my license over it.
So here's the other thing from the client perspective too, right? Just because, and it goes back to the same thing with massage, just because you've received a massage does not mean you can give one. Just because you have seen someone do a massage doesn't mean you can do one. It is not about what you know. It is about legally what you can do, right? So if I research how to use acupuncture needles and the methodology behind it and the technique, that doesn't mean I can go and start doing acupuncture. Just because I know about the thing itself doesn't mean I'm legally allowed to do it. And it's the same thing with lymphatic massage or post-op massage, right? In the state of New Jersey, you can take tons of body contouring classes, and they're like $2,000 a full weekend. They'll teach you how to do it. They'll give you the tools. You cannot legally practice anything unless you have an actual state license to practice massage or touch people for massage to do body contouring. So you can't be doing wood therapy if you don't have a state license on your wall. You can't be doing cavitation if you don't have a state license on your wall. Massage or esthetician or cosmetology, whatever it is, it needs to be covered under that license. The first and foremost step is to have a license. And then from that license, look up the regulations and see what you're legally allowed to do with that license. You can be an esthetician, cosmetology license, massage therapy license, and do massage therapy and lashes and, you know, whatever it's called, the eyebrow. Oh my God, I lost my whole vocabulary. You know what I mean? Micro blading.
Yeah.
Yes, there we go. You could be doing that and facials and massages, having your own business, but you need to hold both licenses, because you cannot be doing microblading under a massage therapy license. You cannot be pulling drains under a massage therapy license. If you are a RN, registered nurse in the state of New Jersey, working in a surgeon's practice, or a nurse of some sort working in a surgeon's practice, that's a different story. If you're a nurse, that is covered under your license. If you're a massage therapist, it's not. But RNs, I don't know if this is true in your state, Kathleen, but they're not allowed to do massage. They have to be a massage therapist with a license in order to do massage and be a nurse. They can only do like a certain amount of time.
So, and again, it goes back to whatever license you're working under. You need to call the people in the state, at your state capital, that give you this license to make sure those questions. It's not the two of us. It's not even the two smartest people in the world. And it's definitely not your teacher who's going to tell you you can do everything. And it's not even, I love that you talk about acupuncture, because did an internship with a PT, and the PT was from out of state, and then he moved here, and he was allowed to do dry needling in the state he was in before this as a PT, and he moved to California, and you can't do dry needling as a PT in California. So even if you were trained and you know how to do it, you need to call in the state that you're in today that you have a license for, and that's how you know. I mean, this is basic how to run your business and not lose your license. I'm not trying to, ruin anyone's day or, rain on anyone's parade. I am a focused person. I have a license. I have a career. At this point, I have had so much education. I don't want to change my career, and I don't want you to have to change your career either. And all this investment that you've made in the business because someone led you the wrong way, because even if 8 people are in there begging and they need their seroma drain and they need their incision drain and they're putting all this pressure on you and they're screaming at you, this is still like not something you want to risk your entire livelihood under. Because if you start doing something that's outside of your scope of practice, you can run, but like there's going to be that one client, or more often there's going to be that one competitor that they find out about you and they're going to drop a dime on you. And I don't even know if these Generation Zs know what drop a dime means.
I do. But the other thing is from the client perspective, right? Because that's like the therapist losing their license. From the client perspective, if you get hurt, because this has happened where I've had people that have gone to someone who's done incisional drainage on them because a doctor told them to go get incisional drainage. I don't even know what color flag that is, but it's more than red. A surgeon told them to go get their incisions opened and the fluid pushed out. And he called the massage therapist, who wasn't even licensed, by the way, never held a massage therapy license. He called her on the phone. No, she was just a person who was doing this and promoting it, had her on speaker and guided her on how to pull a drain. Well, my client that I met then 8 weeks later, after all of this happened, after she got out of the hospital with MRSA and was septic and hallucinating, all of that, after all of that got fixed, she came to me and she told me what happened. This lady pulled her drain and was using needles to open her up and push fluid out of her right after surgery. She caught a massive infection. They gave her 2 days of antibiotics at the surgeon's office and then was like, no, you should be fine. She's hallucinating in the middle of the night. Her man takes her to the hospital. She finds out all this stuff. She's in there for 3 weeks. And then she finally finds me. And she's telling me all of this. And I'm like, well, does she have a state license? And she's like, I don't know. We went and checked. She does not even hold a state license, but the surgeon is referring to her because she does Colombian lymphatics. And that's how that mess got started. So from the client perspective, because Kathleen advocates a lot for therapists, which I love. She's the therapist perspective. I'm the client perspective, which makes us a great, great team. And our conversations are amazing because of it. From the client perspective, you have no legal recourse. She has been trying to get a lawsuit together for 2.5 years now. She has no legal recourse because this person, there's no board to go to because she doesn't hold a license with a board. So she's not a massage therapist. The state's not going to do anything because there's no legal proof anymore because she's not licensed. There's no credentials, and it's just a person doing a thing. So if you get hurt, if your surgery gets messed up, if you have thousands upon thousands of medical bills to pay because you're in the hospital because someone that wasn't supposed to even be touching you did something, messed up your surgery, and now you have to pay, you have no way to take action. You have no protection at all. And you can go back to the surgeon and try to fight it. But again, the surgeon's not the reason you had the issue. The therapist person was. So the legality falls on whoever caused the problem, not the surgeon. Yes, the surgeon may have referred out, but your choice was to go to said practitioner person to get this done. So now you have no one to help you afterwards. You have to now see me 3 to 4 times a week to get your body back and get your stuff right and make sure you're okay and look normal, and then try to fix your results. So you have to be really careful. You're talking about the fate of your surgery and your body. This isn't just, oh, I want my results to look great. This is, I want to make sure I'm okay. You need someone who is number one, state licensed, and number two, an MLDC or a CLT. All of that is covered in my course. So we're doing a bunch of stuff with that. But I think somebody asked how long it takes to get an appointment with me. It depends. If you're in New Jersey, it's usually 3 to 4 days I've booked out. Virtuals are only held on Fridays, but they're like all day Friday. So that's usually like a week. So I'd say about a week, I think, if that's correct, Alex. And then Alex also did ask, which is good for all of this to mention. I think it was how soon. I'm really bad with this whole finding the comments thing. How soon before surgery do you need to come in and how many times? Pre-op. Here's the thing. This whole thing is about compression, right? And massage and all of that. We're talking about aftercare post-op. If you know you're going to have surgery, the earliest you can come in. Here's why. It's not about, I picked a surgeon, I'm going to have surgery, help me recover. It even goes back to, how do I pick a surgeon? How do I know? Like Kathleen kept saying, red flag surgeon, red flag surgeon. How do I even know that surgeon is a good surgeon? Yes, I'm looking at results, but when it comes to all this aftercare, like I said with my surgeon who was sending people for incisional drainage for someone who was not licensed at all, how do you even know your surgeon is a good surgeon? So if you are going to have surgery and you are trying to prepare for every facet, for garments, for swelling, for your results, for picking a surgeon, for all of it. You're worried, you're scared, you want to know about anesthesia, you have all these questions, or you have no questions because you don't know what to ask. As soon as you are interested in getting surgery and you know, hey, I'm definitely doing this, I've got like 20 grand saved up, I am doing this. I don't know with who yet, I don't know how, but I'm doing this as soon as you can. The latest I see people pre-op is like 2 days before surgery. Because even at that point, we get everything straightened out real quick, right before, and let you know, okay, you are 48 hours before go time. Here's what we need to get straight right now. And you're going to see your surgeon the morning of, before anesthesia. So here is the laundry list of questions you need to ask. So when I see you within that first week or at your week mark post-op, I have all the answers to take care of you so that you're not scrambling. So as soon as you can come in, the earliest you can come in, or right before, whenever, even if it's post-op and you're scrambling, whenever you can, the earliest, whenever, the better. Because all of that education takes time to seep in. Do we have any other questions?
That was pretty much it. Lex says thank you for the appointment question. Yay. And then, so if there's no more questions, I'll get on my soapbox one more time. So I help people. I'm a member of our caregiver coalition. So I talk to people about their caregiver experiences. So if you're a caregiver for like your grandma or your mom, and like after surgery, and like you're the dutiful daughter, and someone comes and says like, hey, like this is how you change the dressing, like this is how you monitor their medications, this is how you do all these things that sound like a nurse or home healthcare person would be able to do them. Just because you can do that for your mom when she is sick does not mean, bam, you're a nurse and you can do those same things and charge for them to someone in your state. So just because you know how to do it, just because you've been to, like she said, like you've been to 1,000 massages, doesn't make you a massage therapist. But it gets that gray area because we did do a lot of, stuff that ventures over into like home health care when we were caring for people as caregivers. But just because you can monitor and give medications to somebody that's in your family does not mean that that's not a licensed profession in your state. And just because you can do it in the family doesn't mean you can start charging for it as a profession, because your health department is going to have a huge problem with that. So that's
the same thing with garments. Like, just because you sell fajas doesn't mean you know anything about post-surgery garments. Just because you're an alterations or tailor person doesn't mean you know anything about compression. Just because you took a body contouring class or a 3-hour lymphatic basics class doesn't mean you are certified to be practicing MLD or a certified CLT to be working with lymphedema. So yes, there's education out there in the world we live in today, which is fantastic, but you guys as the clients need to look for credentials. Same thing with your surgeon. I have a beautiful hour-long video about the difference between a cosmetic surgeon and a plastic surgeon. You need to look for the letters after the name, like with therapists, like massage people, LMT, licensed massage therapist, CLT, certified lymphedema therapist, MLDC, which is MLD certified therapist. You guys got to start looking for the actual credentials, because even, let's say you're fresh out of a CLT class, you are so armed with knowledge, resources, contacts, mentors, everything that you could possibly need to start seeing clients and start working on swelling and start giving information about compression. You may not be seasoned like Kathleen and I and worn in, but you have enough knowledge to do better than someone who took a 3-hour course, because then you have the tools and the knowledge to apply to the post-surgery situation. If you have experience with surgery, you only have enough information of what you went through. You don't have the tools, the knowledge, the science that Kathleen and I from the training have, versus I took a body contouring class, I know how to do body contouring, but do you know the science? But do you know what the manipulation of fat is actually doing in the body? But do you know why it works? Do you know how it works? Or do you just know how to administer the technique and that's it? So there's the difference in training when it comes to credentials versus experience, just like Kathleen was saying about at-home care.
So great comment. Here in California, I had a nurse want me to drain a seroma for her mom. I told her I wouldn't do it. She's the nurse. She could do it. And she said it was a liability for her, which is also a liability for us. So think about that. Think about that. Yep.
Oh my God.
So,
thank you for that comment.
So that if the nurses are getting smart, then like we need to get smart too, because that nurse license, like that's one of the toughest classes from what I've heard. And it's blood, sweat, and tears to get that nursing license. And please do not let anybody convince you that you can do things that and you don't need to call your nursing board. You know, CNA all the way up to RN. Like, make sure you're doing the right thing under your license, preserve your license, so you can run your business for another day. It's never worth that one client that's really, really insistent. If it's not legal for you to do, then it's not the right thing you do. And it's happened to me. I've had people, just clients, and that's real interesting too, because it was a nurse. Now that I remember, it was a nurse too, that she wanted me to drain her incisions. And I said I wasn't legal. And she was like, she was a nurse, it was going to be all right. And it's like, well, then why don't you do it? So, yeah. And then the board has also stated nurses are not massage therapists. They need a referral from a doctor. So that's the other thing. Again, this is why I want you to have that conversation with your peers at your board, because this is the unusual and very interesting and fantastic thing about being a massage therapist is you can come to me for massage and you don't need orders from your doctor. And some people need orders from their doctor, that's the first thing. I learned that at a lymphedema conference, where people were telling me that they were going back, CLTs were going back to get their massage license so they could do manual lymphatic drainage on clients as a private practice, because in their public licensure, they had to have orders from a doctor and they couldn't just do ongoing care. And like a OT has to use that the massage therapy license to be able to just take someone off the street and give them the massage, give them the treatment.
So PTs are only allowed in New Jersey to do it if they're in a PT practice, and insurance will only cover a certain amount of units, and they have to do referrals. So if you guys are looking for post-op massage, unless you are already seeing a physical therapist, and even still they don't have experience with doing full body MLD, PTs are usually just working on certain areas for lymphedema. They're not doing full body. So they're going to have more experience with just one section. They're still going to help, but it's not going to be as in-depth of, like Kathleen said, without a referral, just walk in, get what you need, someone who's seen a lot and done a lot, because they don't need to be in that box of referrals. One of the other things, client perspective wise, when you're talking about a doctor or a surgeon who's like, oh yeah, this person can drain your seroma and it'll be fine. Like my client, right? The surgeon referred her to my client. So she was like, okay, well, it's coming from the surgeon. So she's working under the surgeon. It must be okay, like you said. Your person that's doing that, ask them directly, are you licensed? Don't ask them what license, just ask them, are you licensed? And then say nurse or massage therapist or whatever, and then go Google state of blank to do massage with blank license. And you will find the regulations and the statutes for your state from whatever board that allows you to do that. Like there's so much confusion around it, but it's really easy. Ask for the license and then find out what is allowed as far as massage, because MLD is considered a massage technique. And in most states, I'm not sure about all of them, of course, but in most states, you have to be a massage therapist to be able to perform MLD in a normal setting. Like you said, with PTs, they're allowed to do MLD in certain units or for a certain amount of time in the practice that they're in. Nurses have to also have a massage therapy license or MLD credentials to be able to do MLD, but need a referral from a doctor. So when you're talking to your surgeon, make sure you're finding out, okay, this person that's going to be pulling my drain, this person that's going to be doing my massage, this person that's going to be blank, what is their license? Because you need to know that. So whatever the license is, then you can go on your Google rabbit hole of research. But you got to know that first, because how many times do you hear, Kathleen, when you ask somebody, oh, were they licensed, blah, 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 and they're like, oh, I don't know, I didn't check. I'm not going to go get my hair done by someone that I don't know if they went to cosmetology school. I'm not going to do that. I mean, I don't do anything else. I don't do nails or go places to get things done, but that's the only thing. Like, I wouldn't go to anybody to get a haircut. I want to make sure you have a cosmetology license and you went to school. So it's the same thing with, especially with surgery, but you guys trust your surgeons. And when you guys are going down the Google rabbit hole to find these providers, you think, oh, well, they're listed up here as lymphatic massage. You have no idea what that is to begin with. You go in and they're rubbing you down with oil, like this thick goo, and just rubbing the living crap out of you. And they're not even a licensed person to be touching you. So whether it's nurse, PT, OT, because OTs can do MLD too, OTs, massage therapists, they have to hold a license in your state to touch you and do massage. That's as simple as it gets. Whether you're the one practicing or whether you're the person receiving, you have to have this, whatever your state license is, to be allowed to massage or touch someone, because it spreads across PT, OT, LMT, RN, LPN, CNA. It spreads across all the licenses that they can do it, but in certain quantities, in certain ways, with certain certifications. So what you want to find out is, in your state, what license does whoever need to have in order to give me massage legally? Then you go from there.
And this is in your class?
Oh yeah, this is all in my course. This is like this. We have an entire section on this in my course. I'm actually working on it today. But it's broken out as far as what is the difference between MLD and CLT. Like, what are the differences in training? What are they going to know as far as fibrosis, swelling, compression, the difference in training and what they're supposed to know, and like the knowledge they're going to have if you're looking for a CLT versus an MLDC. Who's allowed to pull drains? RNs, DRs, who's allowed to do wound care, like who's allowed to do all the medical stuff, what is the role of your massage therapist? Because a lot of times, again, there won't be credentials on people's websites, and you call them and all you have to go off of is what they say. And if you don't know what you're supposed to be listening for, you're going to walk in, be rubbed with oil everywhere, have your incisions expressed, and think it's MLD, and because you don't know the basis. So in that whole module, we talk about the role of an MLD therapist, or the role of your post-op therapist, your lymphatic therapist. What are they supposed to be doing? What must they have? And what should not happen during your session? If you're looking for a CLT, the squeeze massage should not happen. The oil rubbing should not happen. The machines, because in New Jersey, therapists are not allowed to use machines, massage therapists. It is not legal to use machines other than a muscle gun. And ultrasound just got passed. So that's the only other thing. But we're not allowed to be doing cavitation, radiofrequency, none of that. I actually have on my Instagram too the AMTA legal proceeding and the state board legal proceeding that we are not allowed to be using any machines, cavitation, radiofrequency, anything like that as a massage therapist. That is for like a med spa RN situation. But when you guys go looking, you type in lymphatic drainage near me, you find a million listings of all these people with no credentials on their websites, and you start calling around. The biggest part of this course is questions to vet your MLD therapist, because they can sit there and tell you the sky is purple, the ocean's blue, and if you've never seen the sky or the ocean before, you're going to believe them. And that don't make sense because that's not how the sky works. But
it's blue.
Yeah, exactly. That's the thing. They give you enough to believe.
Not purple.
They make it make sense, right? Like, oh, I could see how that would make sense, but it's not real. It's not legit. It's not by the book, and it's not medical science. But it sounds kind of okay. Like everything I do, I back up with the medical journals. You know I love my medical journals. But they'll tell you just enough to make it sound good. Like, oh, your fibrosis is adhesions. It's scar tissue. We need to rake through it really hard and push it out of your incisions. That's not how that works medically, ever. But they make it sound like it's okay to make sense. So my biggest part of this, and it was supposed to just start as a PDF that you guys can buy and download, but then of course it's me, so I need to explain everything. It turned into a course, and Alex hates me for it, but it did. The biggest part of it, which you guys can buy as an add-on to the course, is the question sheet. Questions to vet your MLD therapist. Because if you ask them a question, and they're not like Kathleen and I, where they will break it down and rip it apart to make sure you understand it, they don't have the knowledge. And if I ever don't know something, I tell you, this is what I know, but let me get back to you. Because I'm going to do some further research because I have some ideas that I want to confirm before I tell you anything. Kathleen's the same way. Kathleen will tell you things straight as it is, facts, science. If you ask her a question, she'll answer with like a million different facts to back it up. But if you guys don't know what questions to ask to make sure that they're concrete in their knowledge and their training, they could tell you, oh yeah, I'm a CLT, but they may have never finished the course. They may have done just enough to know enough, but they may have never finished. Or they may have done, yeah, I'm MLD certified, and they've done a 3-hour course. They don't actually hold an MLDC or CLT credential. And I can show you guys how to verify those, depending on what school they told you they were from, how to check their credentials to make sure they actually did finish the course and know what they're doing. Because there are a lot of people out there that have on their website manual lymphatic drainage certified, and it's a 3-hour continuing education. It's not a 45-hour or 135-hour course. So on that question sheet is all the important questions where if they know what they're talking about, I put the question and then I put what they should be saying as the answer. So you guys know, okay, yeah, this person sounds like Ashley. This person sounds like Kathleen. They're on the right track. They're good to go. Because I have a bunch of therapists all over the freaking state that I refer to, but I don't know if they're in your state. And Google is God. Not everybody is on a therapist directory. Not everybody, you're not going to go to the 4 different nationally accredited schools, print out all the lists, and 90% of those people may not be in practice in your area, or they may be inactive, or they may be working in a physical therapist's office that you can't get to because you don't have a referral to get to them, and you're not part of that practice. So this is how to find overall, with all the things Kathleen and I talked about today: compression, squeeze massage, regular massages, all the things in this course. That's what the point of it is. So long answer, but short answer, heck yeah, I cover it.
Great. And you talk about the ranking of credentialing schools.
Yes, I do.
Anybody can issue you a certificate that says certification. You can get a certification from a 1-hour class.
Mm-hmm.
You can get some of the things that, like, not outside of this, but some of the things I've seen on Facebook, like you can be like a certified NLP coach for $7 on Facebook. Like, it's the word certification does not, unless it has like some kind of government behind it, like it's worth the paper it's printed on. And I hope you did not pay $2,000 for that piece of paper.
Well, that's the thing, right? So like with body contouring, you can take a $3,000 body contouring class. It's 48 hours. But then you can't use it because you're not a massage therapist. So schools like ACOLS, I know ACOLS will ask you, before you sign up, you need to send in a copy of your massage license proving that you are a massage therapist certified to practice. So you have to send in a copy of your license before you can even take their courses. Once you do, you can then take their courses, because Norton's the same way. Right on registration, they ask you, you need to send in a copy of your state license. So you either have to be a licensed a licensed massage therapist, PT, OT, RN to even take the course. You can't just go online and take it. You have to be licensed. Like the MLD Institute International, they only teach courses through New Jersey Massage School. They don't do them just online, everybody take it, at least in in-person ones. And then ACOLS is the same thing. They've asked you to send in your state license before you even register for the class to verify that you're allowed to even practice this. Norton is the same way. I think Close is the same way too, where they ask you for your state license before you even get to take the class. So all of the schools that I include in this course where you have therapist directories to find an MLD therapist, they're all already, before they even take the course, licensed to be doing this. So you won't even have to worry about that if you're finding someone off the directory. The only thing you'll have to worry about is if they're a massage therapist or a PT, because PTs and RNs, you're going to need a referral from a doctor to go in, and they're not going to be as easy post-op to get to. Now, there are some PTs that are private practice that will, take people from everywhere. But it depends. It depends on who they are, and that's kind of half of your research, is knowing the questions to ask, knowing what the heck you're looking for to begin with. If you've never seen milk and you walk in a ShopRite, you're never getting out of there. That's not going to happen. So you got to know what you're looking for first, which is the lymphatic drainage part and post-op, and then know where to look. Because again, Google is God. Not everybody's on a therapist directory, but also the people that are on those directories, they definitely hold that license. Whether it's still active or valid, when they took the course, they held that license because they couldn't take it otherwise.
All right. Sounds good. We're getting lots of love
in
the comment section.
Thank you, guys. We love you. I think that's it, right? Let me check the questions thing.
Yep.
How do you verify your compression garment pressure in your post-op garment? Ooh, what a question to end with. Kathleen, how do you verify? Because I send my line of compression garments, the Amare garments, to get Zwick tested from the Germany machines. I'm extra. I cannot say. When someone brings me a garment from Amazon, because I do this so much and I've designed my own garments, I feel it the minute I put it on them. I know exactly what the material is, whether it's Lycra, whether it's spandex, whether it's PowerNet grade 1 or 2, what fibers it's wrapped. I know everything. So I cannot speak on this. This is a you question.
So I like to, I'll take a page out of your book and do it from a not therapist perspective, but from a person's perspective. Say you have a garment on. If you feel like you can't take a deep breath, if you feel like you're getting like acid reflux, there's just like a feeling of dread, or just like it's too tight, the whole thing is like suffocating you. But this is legitimate, like, you know, like you're constricted. That garment might be too much compression for you. And I know that you want to order a garment that has your dream waist measurement on it, and just like stuff yourself in it and just like never eat again. And that's how we're going to get to the goal. But that's not healthy for your skin, especially after you're just had surgery and that skin really needs blood flow. You really need to have the blood flow in there. If your stomach is like, your abdominals are compressing your stomach, and your stomach is up into your throat, and you can't eat a full meal, like, that's why wear compression for a year, because they can't eat a full meal. But I tell people, if you're never ever, why would you ever wear this garment to Thanksgiving? Like, what are you talking about? Like, your garment might be too tight for you. And what I want to see, what I like to see is, I'll use the Juzo compression monitor if someone really needs, this lesson. But diaphragmatic breathing is actually you using your body to massage yourself. And I can it's like a little pressure monitor. It has like a little air bladder in it, and we can shove it down into your garment, and I slide it down there till it's right over near the umbilicus. And I say, great, now show me, like, just breathe. And you can see it'll go up to like 22, 18, 22, 16, 22, 18. And that is your skin getting slowly compressed and then not compressed, compressed and not compressed. And then that's how we really get into the brain, that like you can just gently massage your skin and gently move the fluid in that lymphatic system with that diaphragmatic breathing, as the foams are taking on and evening the compression up. And that's why you need the garment that isn't like cuffing you, so you couldn't possibly move your inhale and like move your abdomen in and out, and you have to breathe way up here because like you don't even have any lung function, you know, below like your 7th rib, because that garment has you in like a chokehold. So I want a looser garment with some foams on it, not loosey-goosey, like we're not able to put our entire hand down. Like as soon as you're like, when they walk in at 3 weeks and they're like, Kathy, I think I got this all handled, like this is great, I can get my garment on in 2 minutes. And the whole thing foams. And then I was like, all right, we might have to get you a smaller garment. So that's what I usually see. If people are walking in like all confident, they got their like own like song that they're walking into, like it's that I'm the man from like what's his face, and they're talking about like they got this whole surgery thing figured out, then it's probably time to add the foam garment and get that compression up. But if you're also walking in like on stilts because like you haven't been able to take a diaphragmatic breath in like a week, then that's not good either, because of the reason I told you, because your body needs to move. And then the other thing, especially like the week after surgery, if the feet are starting to swell, if you get like, and if you do, like most people will get a smaller garment. Not everyone's just going to pack the foam in, but if you get into a smaller garment and all of a sudden the legs start swelling, that butt is too small in the smaller garment, the thighs are too small, you're starting to get some swelling in the feet. That's the other key, that this garment is too small. We need to figure out with foams, we need to get you to a correct fitting garment to help you monitor and slowly keep that swelling out so your body can heal and we can get you to the result that you want.
So I have a reel where I do a garment check, right? How do we know if it's too big? How do we know if it's too loose? So when we're talking about checking the garment pressure, like checking how much MMHG the garment has, on the body or with off the body, unless you have a pressure monitor or a Zwick machine that tests the garments beforehand and you send them out for testing, there's no real way to know. Something like, if you go on Amazon, something like compression pants, like sports pants, will say 10 to 15 sports compression, mmHg. Or something like a medical grade garment is 20 to 30. So anything that is 20 to 30 mmHg is considered a medical compression range, is 20 to 30. So our garments are 20 to 30. When you're talking about knowing if it's too tight or too loose on someone versus the brand itself trying to measure the actual compression of the fabric, you can use, when it's on them, that Juzo machine, or you can ask the company, if they are an actual medical garment company, what grade of compression it is. Like Juzo, Job, Sigvaris, Lymphedivas, they all tell you 20 to 30 mmHg. It depends on what you're looking at, right? I don't know if Marina has their measurements on there as far as the mercury. Do you know, Kathleen?
I think so. I think
they should. And I believe they're 10 to 15. I don't believe they have 20 to 30. I could be wrong about that. I haven't looked into it as much, so that's something you guys can research. But like Kathleen was saying, so 3 things to check for to know if your garment is too loose or too tight. And this is where we'll close out this video. So if your garment, these are the little hookies of the garment, right? If you can get your whole hand down the front of the garment, it is way too loose. That is number 1. Number 2, if you do this with your finger, you just put your finger in and you bend your finger like this, and the garment has good recoil, it is still compressive and it is okay. If you have to shove your finger in there and like break your finger trying to do this thing, it is way too tight. 2 openings to check for with that. The one hook at the top and the hook at the bottom by the pubic region right underneath. You do that finger test. Because again, you're not yanking on the garment. It's just this. That's all you're doing. So if you bend your finger and you release and it pulls back, it's got good recoil. It's still got compression on that first hook. If you can't do that and your finger's like killing you trying to push this garment away from your body, it is way too tight. And if you go to put your finger in there, your whole hand slides down the garment, and everybody always laughs at me in session. They think I'm a fucking nut job. Excuse my French. Alex is going to have to bleep that out from the video before it goes on YouTube. They think I'm crazy because literally with the foams, if your garment is a tad too loose on that first hook, but it's not ready for the second hook, the Amare lipo foams are meant to moderate compression. So it'll be like, my first day with the foams in, I'll be like, don't worry, when you see me on Thursday, you'll be on the 3rd hook. And they're like, this woman is out of her goddamn mind. I don't know who she thinks she is, but this thing is not. I don't know what's going. She crazy. And then they come on Thursday, and they're like, look what I can do. And I'm like, oh, God, I needed a new garment like yesterday. I'm so sorry. Okay. And they're like, you were right. I'm like, I know. It's a science. It's not magic or witchcraft. It's just science. That's all it is. But when you have that issue where you're like you're the type of person that you're trying to train yourself out of tighter is better, and you're used to squeezing the living daylights out of yourself in that garment, if you put in all 6 Amare lipofoams, which is a 1/4 inch foam of soft polyurethane medical grade compression, if you put that in a garment that you can squeeze onto the 3rd hook with, and you're used to squeezing the crap out of yourself, put it on the first hook with those foams in, you will never be able to overcompress yourself because you will never be able to get that garment closed over all the foams. So if you're having trouble with clients overcompressing themselves, get 2 packs of the Amare lipo foams, put them in the garment in the video the way I show you, surrounding them 360, and watch them try to close their garment on that 3rd hook. They will hate you. They'll never be able to get it closed, and they'll have no choice but to go back to that first hook and not overcompress. And the lipo foams, like Kathleen was saying, as you breathe, that massage, foams are used in the lymphedema community for getting rid of compression and keeping your swelling moving and stimulating your lymphatics. So these foams are an accelerant for your body to be absorbing fluid into your lymphatic system. They're not just there to get rid of fibrosis. They should be worn your entire lipo or tummy tuck recovery because they're stimulating your lymphatics when you breathe in the garment. But you won't be able to overcompress with the foams because you won't be able to get the garment closed. And when you do get it closed with the foams, like Kathleen said, that with that machine, that internal pumping is going to make the foams work twice as hard for your lymphatic system. So not only are you getting your lymphatic stimulated and like hyperdrive from the MLD, but when I put the foams in you, in the way that I put them in, mimicking the lymphatic pathways, like Kathleen said, with that breathing from your rib cage and the foams, and now you can't overcompress, it's the perfect trifecta of lymphangiomotoricity, fancy word, which I'm going to do a reel on in 2 weeks. It's the perfect trifecta of propelling your lymph fluid at 10 times its normal rate, 100 beats per minute, because now you have a garment that you physically can't overcompress. You've got foams that are constantly stimulating your swelling to be reabsorbed, and you're not cutting off blood supply anymore, so everything's going to heal 10 times faster. This is why we love the foams. And unlike most Amazon things, they are fully machine washable because you gross 8 weeks with the same foams that you haven't washed on your skin. Just a little side note.
Yeah.
But anything else you want to add?
March is Lymphedema Awareness Month.
Yes! Please. Woo!
If you or anyone you love have a cancer diagnosis, inform yourself of lymphedema. Learn is a great website to start looking at. There's a lot of position papers. And it's a lifelong chronic disease. The frustration is that a lot of people have low awareness of it, especially people after cancer. And this is just something that we can do some simple risk reduction practices to lower your, improve your chances of never, ever getting lymphedema. So it's just something that it's better to be informed before rather than when you get swelling on the arm or the leg. So this is the core and the center of both of our educations, is helping people after the chronic disease of lymphedema. So Lymphedema Awareness Month, I'd love to spread that out to our community because everyone has someone in their life, whether it's a friend or a loved one, that is touched by cancer. And this is doing the simple learning on the internet at websites like Learn can give you the information that you can share with that loved one to help them reduce their risk of having lymphedema after their cancer diagnosis. There is also primary lymphedema. Lymphedema is also around the world with mosquito bites and nematodes, and podocynosis is also with an infection that comes up from certain types of soil. So it's definitely a worldwide disease that we both urgently need to have a cure to.
Yes.
But as of today, there is no, reliable cure where everyone's not getting cured from lymphedema yet. So what we can do today is get informed and share awareness and make everybody more aware of it so that we can reduce the risk through risk reduction practices. And thank you so much, Lex. We're getting some love in the comments. Thank you. You guys were great. So where will this be in the future? This will be on YouTube?
So this video is going to go on our podcast and our YouTube. It's going to go up probably Friday once Alex does her magic. Like you guys asked before, if you want to schedule a virtual with me, if you need help with garments, if you need help with fibrosis, if you need help with compression or massages or finding someone to help take care of you, call Happy Alex. And also this week, coming up, I have 2 more lives. So I have a live with Real MLD Samantha out in Chicago to talk about all of our products, not just the foams, but I'm going to break down the science behind every post-op product we offer in our shop, what it's good for, how to use it, what the normal thing you would use, like the regular arnica, what the difference between that and this post-op cream that we use that has 2 arnica plants in it, not just 1, and what the difference is between the products that you get at CVS and the products that we actually have, which are like the super powered version of what you're buying at CVS. So that is going to come on, oh God, Samantha, when is that? Is that Thursday? Let me know in the comments. I think that's Thursday at 7, I believe. And then I'm doing a live with Happy Alex soon for answering common questions that we get called about all the time that people ask. like incisional drainage and all kinds of things and the answers to them. So that's another live that's going to be coming up soon. That will be on the podcast and the YouTubes as well. Our course, yes, that post-op shop live is Thursday. Thank you, Samantha. At 7, that course that I'm launching to like everything you need to know. I did all the research for you. Everything you need to know about lymphatic massage post-op and finding a lymphatic therapist. That course is going to release in the next 2 weeks. So that is currently being recorded. This week, it's going to be posted on Teachable, like Kathleen has her courses posted on Teachable. It'll be posted on there. The link will be in the bio. I'll do a whole YouTube video about it, explaining everything about the course. I'll do a bunch of reels about it. I'll keep mentioning it in all these videos that I do. You guys will know when that launches. And how to get access to it. So that is coming up in the next 2 weeks as well. If you want to get your products now to start working with the foams for the garment and things, Amare Post-Op Shop, link is in the bio. And if you want to set up a session with me, virtual or in New Jersey, Highland Park or Elizabeth, 732-841-0142. Call the office and speak to Alex. She can answer questions about, should I come in now or should I wait? What do I need to wear? How many times would I need to come in and things like that. Well, that she won't be able to answer. That's me. But all the general questions about like what's going on during the massage and all that stuff, she can answer. She is the scheduling coordinator. So give her a call, 732-841-0142, and she can help you with trying to get set up with a session with me. If you DM us, we will not respond. If you email us, we will not respond. We will tell you the same thing every time. Call the office. We need to actually speak with you. So there's all of that. I don't know what happened to Kathleen. I think she disappeared. Okay. Well, this was great, guys. I will see you all later. Ashley with Amare. Goodbye, Kathleen, wherever you went. But I will see you guys soon. Thank you for being here. Thank you for all of your questions. We love hanging out and talking to you guys. And